Good morning. There's been one new positive COVID-19 case in the Northern Territory overnight. But the news isn't bad, it is good. He is a 48-year-old male. He is a household contact of case number 1 in Katherine. He was identified early as a close contact and he's been in the Centre for National Resilience since November 5. He's been in isolation for his entire infectious period. We know this because he initially tested negative upon arrival at Centre for National Resilience. His second test also came back negative. It was not until last night that his third test came back positive. This demonstrates very clearly that our test, trace and trap system worked. Because our systems kicked in straight away, the new case was not a threat to the community. He is fully vaccinated and is experiencing mild flu-like symptoms. Our total number of cases for the Darwin-Katherine cluster is now 4. And further good news, there are no new close contacts and exposure sites linked to case number 4. I'm also pleased to be able to report today that all of the other indicators in Greater Darwin are excellent. I'll go through all of these in a moment, but I can confirm up front that we'll be lifting the lockout for the Greater Darwin region at midnight tonight. Thank you to the people of Darwin, Palmerston and the Darwin rural area. You have been champions yet again. I'll also go through our exit plan and mask rules for the coming days shortly. But first, to the key indicators which have given us the confidence to be able to lift the lockout in Greater Darwin today. First, all wastewater testing results from all the right areas in the Darwin area up to November 7 have come back negative. Secondly, police and health put in a huge effort yesterday examining the CCTV footage from Noonamah, Humpty Doo and Wharf 1 as part of contact tracing efforts. As a result, these sites have subsequently been downgraded from close contact sites to casual sites. The only exception is a 15-minute window between 7:15 and 7:30 p.m. at the Humpty Doo Tavern, where the source went inside, and police are undertaking further investigations. So Humpty Doo Tavern between 7:15 and 7:30 remains a close contact site. Anyone around that window is considered a casual, any time around that window is considered a casual contact site. Some individuals have been identified as close contacts. We are doing the final testing work with them now. These results will be back today, and there's one reason why the lockout will lift at midnight as planned and not 5 p.m. as Katherine did. All other close contacts are in isolation and all have been tested and all are negative. There are 914 Darwin casual contacts that have been identified through either the check-in app or who have self-identified. So we are feeling really good about the contact tracing work we've done. Test numbers have also been great. We have done 2,387 tests across the territory in the past 24 hours. All of them, bar today's positive case, came back negative. Thank you to everyone who came out and got tested. The volume of testing and negative results that have come back in Greater Darwin give us the confidence to be able to lift the lockout. We'll also get the wastewater test for the Darwin area for November 8 tonight before the midnight lift. So with all of the above factors in mind, we can move out of the Greater Darwin lockout with confidence tonight, knowing that we've traced and trapped the virus. As I said up top, we couldn't have reached this point without Territorians doing the right thing, and I thank you again for being the best. The overwhelming majority of you have complied with the CHO directions and made it easier for our tracers and our experts to do their job. I'll move on to the mask mandate. The mask rules will stay in place until Friday 5 p.m. This will be exactly one full 14-day replication cycle after the Territory was first exposed to the virus. All things going well, the mask rules will lift for both Katherine and Darwin at 5 p.m. this Friday, November 12. In terms of rules around masks, they will be the same for Darwin as they are for Katherine. You must wear a mask when you cannot physically distance yourself 1.5 metres from others. You must continue to keep wearing your mask in shops and bars and in all public venues. Obviously, that's social distancing in mind. You can exercise at our mask if you're able to do so at a safe distance of 1.5 metres. This includes at the gym. We are allowing indoor and outdoor sport to resume without the wearing of a mask. You must keep your mask on before and after the game. Dancing is allowed at venues and bars with a mask. So thank you again, Territorians. You have been outstanding.
Thank you, Chief Minister. I'd just first of all like to send Dr. Haggis' good wishes to everyone, to the community. He's in Darwin on leave and been watching closely the outbreak and giving his advice as you would expect. We've now got 4 cases. The new one, fortunately, has been in quarantine the entire period of their infectious period, so we're very confident that doesn't create any further risk. As the Chief Minister has outlined, we're now in a position to lift our lockout at midnight. I'm confident in that decision. we have seen, and I'm delighted to see, that people have come forward to get tested at a very high rate. Last night, our testing facilities were very busy of people coming forward from those exposure sites that had been identified yesterday. What that shows is people know that, well, they're doing the right thing by coming forward, but they also know that they're vulnerable. I would like to see those people who've come forward to get tested to now get vaccinated. The fact that they've come forward to get tested tells us they know that they're vulnerable, and please, all of you, come forward now to get vaccinated and get your friends to come forward. This is the way out. We've said this before. The docketing modelling yesterday was an incredibly important message that we tried to convey to all of you and to the community. And the Chief Minister said the docketing modelling shows that our way out of this is to get vaccinated. That's all I want to say. Thank you.
Good morning, everybody. Again, this is good news for today. So to the broader Greater Darwin population, thank you very much for your efforts, for your compliance, for your community first attitude. It's certainly gone a long way to being able to assist us in making the decision that's been realised today. Of course, we do have to talk to the fact that the mask mandate does remain in place until 5 p.m. this Friday. That's in place for Catherine and the Greater Darwin area. Please help my people to help you just by being compliant. They don't need to be caught up with non-compliance and more rubbish, much like we saw over the weekend. Talking to the weekend, we have taken some further action, as I highlighted yesterday. Last night a notice to appear was issued to an individual that was involved in the protest. They've been given an indication that we'll be laying the charge of hinder police and taking part in riotous behaviour. We're also in contact with an individual that we identified who we believe had thrown some liquid at a number of our police officers. Through communication, we facilitated the attendance of that person this morning to a local police station where they were arrested, and they're currently in custody awaiting to be charged. There's another individual that we are in the process of identifying, and we'll follow a similar process as it relates to that individual. We still don't have confirmation on what the substance is. We'll be sending an item interstate for further forensic analysis to determine what that chemical was. Suffice to say, though, that there has also been an additional amount of work as it relates to those who are wearing or not wearing masks, as the case was on Saturday, and infringement notices will start to be issued through the course of today and ongoing for those individuals who blatantly chose to disregard the directions. It's a disappointing outcome. It's going to tie up a lot of our police resources, but my police officers do not deserve to be subject to the treatment that we saw, particularly with the warnings that were provided. They were adequate, they were reasonable, and that behaviour was totally intolerable, and I will make a stand to protect my members for that. Again, the work that's been undertaken to get us to this point in time has been significant across the board. Our health employees, other NT government agency employees, police officers standing out in road border checkpoints in some pretty humid and awful conditions. Indeed, there's some storms and the like that have come through. Those people are doing what they believe in. They believe that they're here to serve and protect the Northern Territory and you. So please, as a community, do the right thing. Check in when you do go to venues. Please get the vaccination. It is something that will protect the Northern Territory and all that we hold dear and precious. But more broadly, thank you again for helping us get to the position we're at. Don't drop the bit just yet. Let's get through Friday afternoon and enjoy Friday night together. Thank you.
Chief Minister, we're a few days away from the mandate now, and the ABC's spoken to several businesses who, we should preface this by saying they're not anti-vaccination, but they feel they've been thrown under the bus by the mandate, given that they're the ones that have to do that have to help enforce it. How do you respond to the suggestion that you've done yourself no favours by outright rejecting any concerns that people might have about this mandate on Friday?
Conditions of employment are quite common. Mandates are quite common. In life, it's mandatory to wear a seatbelt, for example. Depending on your work settings, it's mandatory to have a white card, it's mandatory to have an ochre card. I believe this is a really straightforward principle direction to apply. We're applying it ourselves, so we're not doing anything we're not doing ourselves, working through 22,000 public servants. So I'm not asking anything of a business that the public service is not also going through. I think it's an extremely straightforward thing to do. I think it is only an issue if someone chooses to not be vaccinated. Now, I believe it's extremely unfair of that person to make that decision and put pressure on their employer, but for me it rests with that individual's made a choice not to be vaccinated, because it's only an issue if someone makes a deliberate decision to not be vaccinated in a workplace where they will be interacting with the vulnerable and putting those vulnerable at risk, or if they're in a workplace where COVID is likely to come to them and therefore they are at risk, or they're operating on infrastructure that put the territory at risk. So I think it's a very simple, straightforward, principles-based direction that we're implementing ourselves, and I think it's completely fair to ask business, as we've done on multiple occasions, many governments over many times, ask them to implement a direction.
Shouldn't the onus also be on the vulnerable to protect themselves?
I believe there is every single motivation for a vulnerable person to get a vaccine. They should absolutely get a vaccine, but in terms of implementation and how we go about this, doing it through conditions of employment is doable. We physically can't grab people on the streets and vaccinate them, but I would say to anyone out there who is vulnerable, you should get the vaccine. You're among the first who have had the vaccine available to them, but obviously this is about making sure that we can guarantee that we're doing everything we can to save people's lives. It's also about making sure we guarantee we keep people's jobs. At some point, COVID is going to enter the territory. If businesses are protected, if their workforce is protected, if their workforce is vaccinated, we won't see what has happened in other jurisdictions where the economy gets given a whack as well. We've got ourselves all the way through this pandemic with care, making sure we're saving lives, and saving lives, saving jobs. This is another measure, again, they'll both save lives and save jobs.
It looks like disaster's been averted again. Is the NT just getting lucky?
I think there are an absolute stack of public servants out there busting their guts to keep Territorians safe. They are working incredible hours. Anyone who ascribes this to luck does not understand the magnitude of work required to have implemented all our policies over 18 or 19 months. It is a quite remarkable feat. It goes to the very spirit of public service. I don't know if you could have a loftier goal than what our public service have done over the last 18 or 19 months. They've genuinely been on the front lines across the Northern Territory in a whole range of locations, some quite hostile, formidable. The Commission has been out to the border checkpoints like I have. Some of these are in difficult locations, working around the clock. It's quite an extraordinary effort. And it couldn't happen without Territorians understanding it, getting behind it and cooperating. So in this very last occasion, the 26-year-old who was symptomatic getting tested, becoming positive and allowing us and all our systems to kick in. So just a genuine thanks to all Territorians too.
Do those public servants deserve a pay rise then, given the amazing work they've been doing?
Yeah, we're offering them $1,000, $1,000 a year for the next 4 years. I want to keep every public service in their job. I believe capping wages is better than cutting staff. I want to keep every public servant.
What's been the response from Aboriginal organisations to the new measures you talked about yesterday for remote communities and the new modelling for remote communities?
So the feedback yesterday from the briefing in the land councils was good. There is a meeting happening this morning, a more extensive meeting. I haven't had the feedback from that meeting yet. But obviously the number one priority of all adulty modelling remains vaccination, either before or after a case. Vaccination is number one most important thing. Absolutely do vaccinations, get vaccinations everywhere.
Have these cases and this lockout delayed our roadmap at all, or are we still on track?
No, everything's still on track. The system's still working. This is probably an example where someone has tried to dodge the system. Obviously, home quarantine at this moment is on track for November 22. No changes. The home quarantine pilot is working well. So that's all on track for November 22.
Just back on the
senior figure in the Federal Department of Health who appeared in the Senate estimates hearing a couple of weeks ago and said that your government is being given the data from the ARCHOs, that it's accessible through the air. But you're still claiming that you haven't got the data. So what's the truth? Has he misled a Senate committee? Or?
Well, I can go through all that because I think, let me start from the start. Every vaccination that's given is recorded. So everyone has access to the knowledge of that vaccine. It goes into what's called the air. And then you can break it down in a number of ways. You can break it down by Medicare, postcode, local government area, ABS, etc. We also record all the vaccines we give in our own database called PICAS. We've obviously have the vaccine rates for all our individual communities, and we released all our vaccine rates for all our individual communities. So both the Archos and the Australian government have said a number of times, oh, you know about the vaccines in the territory. Yeah, it's true. We know the vaccines we deliver in the territory, and we know them on these broader levels. What we don't have, and still don't have, is the vaccine rates for individual communities. And as we explained yesterday in breaking down the Doherty modelling, there is absolutely a compelling reason why we must have the vaccine data for individual communities. Our entire response to a case in that community will be determined by the vaccine rate in the community. The number one response to a case in a remote community is reactive vaccinations. You do everything else, obviously. You do your TTIQ and your public health response and your primary health response. You do all of that. That has to happen. But the number one response you can do is a vaccination effort. Now, I need to know the vaccine rate in that remote community to be able to do that vaccine effort. The recommendation out of Doherty is that every individual remote community had their own COVID plan. We've done that. We've got that. We've got plans for every remote community. What's obviously clear now is that you have to have a specific vaccine rapid response plan ready for that remote community too. I cannot do that for the 29 Archo communities because I don't have their individual vaccine rate. I believe there's an absolutely compelling argument for how we save lives by knowing that vaccine rate. I really want individual community vaccination rates for the 29 Archo communities. We've asked politely, we've asked through the media, I've asked through National Cabinet, we've asked from our officials to their officials, we've asked the Archos directly, we've asked the Australian government. We still do not have individual community vaccination rates for the 29 Archo communities. So as a result, we're now recording them as a 0% vaccine rate, and we're applying all our public health measures to those remote communities. If there is a case in that remote community, we'll have to operate as if it's a 0% remote community, flood a whole heap of resources in there around vaccinating that entire remote community. Now, I would like to have a more nuanced response to that remote community. I would like to have that individual vaccination data. I would like to do everything I can to save a bloody life. It's about bloody time they gave us that vaccine data.
Thanks, everyone.
Just in relation to what we were talking about before, with the vulnerable getting vaccinated, it's been suggested that there should be some incentives, like linking it to the school vouchers, for example, or the sports vouchers. Is that something you would consider?
Yeah, we have been considering how we can apply vaccine rates to all the government programs, etc. We've been clear we're working on how we can link it to government tenders, for example. So we are genuinely considering how we can apply vaccine status to a range of things. We have been very clear that we're not trying to punish kids, if that makes sense. Kids don't have a choice about whether their parents are vaccinated or not. If 12, 15, obviously you need your parents' permission. When the vaccine comes around for 5 to 11-year-olds, you need your parents' permission. So sports vouchers, I'm not ruling it out, obviously, but sports vouchers, back to school vouchers, all that goes to caring for a kid. And right now, I'd say I'd be leaning towards not punishing the kid for the decision of the parent.
Chief Minister, just two quick ones from our newsroom as well on another topic. Are you confident that your government has agreed to give Fortune Agribusiness a big water licence for Singleton Station in a process that was proper and fair?
So as I understand it, I can double check this.
Yep.
So I understand there's a review process happening at the moment around that. So obviously we'll always do everything in every process to be fair. I also acknowledge that every process also has an ability to review or appeal, and I think it's going through that at the moment.
Okay. And also, do you believe that your government has improved the governance of water above the process that gave Tina McFarlane a large water licence under the CLP government, as you promised in your election?
Oh, absolutely. We've done huge improvements to how water is allocated. We've introduced the science back into water allocations. We've brought back a whole bunch of water control advisory groups, etc. We've done a significant range of improvements in how we deal and allocate with water. All right, thank you, Ron.
Can we get one from the Commissioner, please?
Yeah, sure.
Yeah. Just regards to this bloke who handed himself in from Catherine last night, what are we looking at in terms of any charges or anything for him?
He'll be facing an infringement for failing to comply with the CHO directions. Of note, we gave a window of opportunity for him to come forward through some inquiries that ultimately didn't come to realisation, so we put out the public call for assistance, and then with a short period of time of that occurring, he presented the Centre for National Resilience. We are awaiting his test results, so a test was obtained from him. We're hoping to have that result through the course of today, and we'll make sure that that information is provided to the public once known.
Can I just ask Dr. Payne that question? Again, we've seen in other jurisdictions where a single case quickly turns into dozens, if not hundreds, of cases. We've had a few instances here now where we've had a single case and it's been limited to 1 or 2 or 3 or 4 cases like we have now. Is there something else up here that's working in our favour? Is whether the density of population also working in our favour when it comes to lack of transmission of this virus?
Yes, thank you. Good question. There could be some element of the weather, but I doubt that that's a prominent part of this. I think what we've been fortunate, and it's not just luck, we've been fortunate that we've been onto these outbreaks early. And the Chief Minister, let me just again reiterate, the person who came forward to get tested, that gave us the opportunity to get onto this, on the track of this outbreak early. You saw what happened in New South Wales when they were somewhat delayed, and it's led to that huge outbreak. And as the Chief Minister said, we've got really some of the best public health experts in the country. They're attracted to the territory. They've worked here for well, generations, but certainly decades. So we've been very fortunate to have wonderful expertise here in the territory as well. And I suppose we've had the enormous cooperation of the territory community. They have been absolutely incredible in the way they've cooperated, by and large, with all our efforts. So I think those are the main reasons why we've been so successful. Each of those outbreaks, you can see how infectious the virus is. Each of those outbreaks could have spread around the territory if we hadn't been able to get onto them early and put all of this enormous effort into tracking them down.
And can I just ask one question? So ahead of the mandate on Friday, is there any possibility that there will be exemptions for frontline police or health workers come Friday to ensure we have enough people working in those positions?
No, there's no. We've worked through all of that, and there is unlikely to be, as I understand, and I can speak from the health point of view, unlikely to be any operational impact from those small numbers of people who may not be vaccinated by that time, but there won't be exemptions.
How reliable is wastewater?
Except for those people, of course, who have a legitimate exemption reason. Yeah.
How reliable is wastewater testing, given a lot of people in the rural area would have septic tanks and not be part of that catchment?
Yes, that's a good point. We obviously rely on it to some degree, but obviously if they're on septic, that doesn't that we can't rely on that there. But in the urban areas where there are large catchments, it's proven to be very reliable in the sense that wherever we've expected it to be positive, it has been positive. We can't rely on a negative test, but if we have a positive test, we have to be able to explain it. And that's why it's so important to have these tests that we've been doing daily now in the last few days, that if there were a positive test, it would change the outbreak investigation unless we knew there was someone in that catchment area, because it would tell us there is someone else in that catchment or others. So it's a very valuable tool. It's been used all around Australia now. We don't have our capacity here in the territory to do it ourselves. We have some very good collaboration with South Australia, but that is something we're looking into, perhaps developing that.
Thanks, everyone.
Thank you so much.